You've seen the headlines. ChatGPT is revolutionizing healthcare. AI will replace your doctor. Millions of people are already typing their symptoms into chatbots. But here's what those headlines don't mention. A massive new study just revealed something that should make everyone pause before asking an AI chatbot about their health. And I mean everyone, including the companies building these tools. This is the story of how AI doctors believe almost anything, and why that matters more than you think. In February 2026, researchers at Mount Sinai in New York did something unprecedented. They tested major AI systems, ChatGPT, Claude, Gemini, with over 1 million medical prompts. They fed these chatbots fake diseases, made-up lab values, completely fabricated clinical scenarios. They wanted to know, would the AI catch the lies? The answer should worry anyone who's ever Googled their symptoms, and that's pretty much all of us. Because these AI systems, the ones millions use for health advice every day, believe the fake diseases 83% of the time. Let me set the scene. Every single day, millions of people open ChatGPT or Google's Gemini and type in their health questions. My throat hurts. Is this mole normal? What does this symptom mean? This isn't hypothetical. Surveys show roughly 1 in 4 Americans have used AI chatbots for health information. In younger demographics, it's even higher. The appeal is obvious. It's free. It's available at 3 a.m. when you're anxious. And unlike WebMD, it doesn't tell you everything is cancer. Or at least, it didn't used to. The problem is that these AI systems learned medicine the same way they learned everything else, by reading the internet. All of it. The good, the bad, and the completely insane. Reddit posts about miracle cures, Facebook groups claiming vaccines cause autism, blog posts insisting that essential oils treat cancer. All of that went into the training data. And here's the critical part. These models have no built-in ability to distinguish between a peer-reviewed study in The Lancet and a viral TikTok claiming hydroxychloroquine cures everything. The Mount Sinai team understood this vulnerability, so they designed a test that would expose exactly how gullible these systems really are. The study was massive, more than 1 million prompts across multiple AI systems, published across 2 major journals, The Lancet Digital Health and Communications Medicine. Here's the headline finding. When researchers presented AI chatbots with completely fabricated diseases, fake lab values, and made-up clinical signs with no safety guardrails in place, the AI hallucinated and accepted them 83% of the time. 83%, that's not a minor error rate. That means if you asked your AI doctor about a disease that doesn't exist, 4 times out of 5, it would confidently tell you all about it. It would invent symptoms, suggest treatments, even create elaborate explanations for conditions that no medical textbook has ever described, because they don't exist. But here's where it gets more nuanced. That 83% was the worst-case scenario, unguarded systems with no safety prompts. When researchers looked at all models with their default settings, the average deception rate dropped to 32%. 32%, still nearly 1 in 3 responses spreading false medical information. And remember, millions of people are using these tools every single day. The performance gap between models was dramatic. Smaller, less sophisticated AI systems, the kind powering many health apps, fell for false claims more than 60% of the time. But the most advanced models, ChatGPT-4o specifically, only fell for about 10% of fabrications, a 10-fold improvement. Still not zero, but a significant difference. Now here's the finding that genuinely surprised the researchers. It wasn't just about making things up. It was about what happened when real misinformation was presented in professional packaging. When misinformation was presented in confident, clinical formats, like a hospital discharge summary or a physician's note, the AI systems were far more likely to believe it. This is what psychologists call authority bias, and AI systems have it worse than humans do. Format the lie correctly, and the chatbot treats it as gospel truth. The researchers tested this with real medical myths that circulate on social media, and the results were alarming. They fed the AI claims like, Tylenol causes autism in pregnant women. This is a debunked myth with no scientific support, but when formatted as a medical note, several AI models accepted it. Another myth tested, mammography causes breast cancer by squashing tissue. Medically absurd, mammograms save lives, but formatted professionally, some models repeated it as fact. Think about that for a second. Someone with breast cancer might ask an AI about mammograms, and depending on which chatbot they use, they might be told, incorrectly, that the screening caused their disease. The study's lead researchers put it bluntly, quote, AI chatbots are highly vulnerable to repeating and elaborating on false medical information. This reveals a critical need for stronger safeguards before these tools can be trusted in healthcare. Before, not after. Before. But here's something that offers a glimmer of hope. The researchers discovered that simple safety measures make a real difference. When they added a simple safety reminder to the prompt, basically telling the AI to double-check medical claims, hallucination errors dropped nearly in half. In half, with a simple text instruction. That's both encouraging and terrifying, because it means right now many systems aren't using even basic safeguards. So why does this happen? Why would AI systems, trained on more medical literature than any human could read in 1,000 lifetimes, still fall for obvious myths? The answer lies in how these systems work. They don't actually understand medicine. They understand patterns in text. They predict what sounds like a plausible medical response. And plausible sounding is not the same as true. A made-up disease with a Latin name and described symptoms sounds just as medical as a real one, to a pattern-matching system. The science-based medicine analysis highlighted this exact problem. Quote, when misinformation was presented in a confident, medically accurate format, the LLMs were far more likely to accept it as truth. Format matters more than facts. Dress up a lie in a white coat, give it proper medical terminology, and AI treats it like a peer-reviewed study. This has real-world consequences happening right now. AI chatbots are already integrated into customer service systems at pharmacies. They're being piloted in hospital triage. Insurance companies are exploring AI for preliminary medical assessments. Some telehealth platforms already use chatbots as the first point of contact. And while the study focused on text-based misinformation, the implications extend everywhere. Voice assistants giving health advice, AI symptom checkers, medication interaction tools. The medical economics analysis put it starkly. AI chatbots lack skepticism. They don't question what they're told. They don't ask for sources. They just elaborate. If you tell an AI that bleach cures COVID, a dangerous myth that hospitalized people, it might not just agree. It might hopefully suggest a dosing schedule. So, what do you do with this information? First, and most importantly, you may want to consider never relying solely on AI chatbots for medical decisions. Ever. This doesn't mean AI is useless for health information. It can explain concepts, help you prepare questions for your doctor, or translate medical jargon into plain language. But for actual medical advice? For determining if something is true? Research suggests you should treat AI the same way you'd treat a very confident friend with a Wikipedia addiction. Here's a practical approach that many experts recommend. If you do use AI for health questions, always cross-reference with established medical sources, Mayo Clinic, CDC, peer-reviewed research on PubMed. If the AI tells you something that sounds alarming or too good to be true, that's a red flag. It may be worth looking up that specific claim before taking any action. Watch for what the researchers call authority bias. Just because information is formatted like a medical document with clinical terms and confident language doesn't mean the AI actually verified it. And if you're dealing with anything serious, symptoms that worry you, medications you're considering, treatment decisions, that's when you'll want to talk to an actual licensed healthcare provider. I know that sounds obvious. Talk to a doctor for medical advice? Revolutionary. But the point is that AI has made us forget something important. Medical knowledge isn't just about knowing facts, it's about knowing which facts apply to your specific situation. AI doesn't know you. Your doctor does, or at least should. The study sparked immediate debate in the medical and tech communities. AI companies insist their safety measures are improving. Critics say that's not enough. Some argue that imperfect AI is still better than no access to medical information, especially for underserved communities without easy access to doctors. But others counter that confidently wrong medical advice isn't better than no advice, it's potentially worse. At least silence doesn't send you to the ER. As of this recording, AI companies are scrambling to add medical safety guardrails, but the Mount Sinai study makes clear we're not there yet, not even close. If you found this breakdown helpful, consider subscribing. We cover stories like this regularly, digging into the claims that shape how we understand technology and health. So let's bring this home. Mount Sinai tested AI systems with over 1 million medical prompts. They found that these chatbots, the ones millions use daily, can be easily fooled by fake medical information. 83% hallucination rate without guardrails, 32% on average across all models, and a troubling tendency to believe lies when they're dressed up in medical language. The technology is improving. Safety measures help, but right now, today, your AI doctor will believe almost anything if you phrase it the right way. The question isn't whether AI will transform healthcare. It already is. The question is whether we'll build the safeguards before, not after, people get hurt. That's not just a technology problem. It's everyone's problem, including yours.